Goldie, Freedom Now Left Warehouse.
Renu ma'am, good morning. Good afternoon. Good afternoon, ma'am. Am I audible to all of you?
Goldie, your camera is on. It's Goldie, your camera is on. It's Goldie, your microphone is on.
Nayak ma'am is there. You are not audible, ma'am.
Okay, okay.
Clear connection. Brittany Nayak has left the meeting.
Good afternoon, everybody.
It's Goldie, your microphone.
Good afternoon, ma'am. So, thank you very much to all of you. I think today's is the last class. I do hope. So, it's from Dr. I am from Dr. Manigrai from RC Bhubaneswar. So I welcome all the learners. So for decision program. So I do feel you enjoy with our all teachers who have taken the class as on today. So I do hope today is the last class. So thank you very much. Over to you, ma'am.
Okay, thank you so much, sir, for your kind cooperation. So today we will start the topic that is the paper 31 and block 6, unit 2, that is your research. Paper research will start. Okay. So any idea you people are having? What is research? So any idea regarding what is research? Let anybody tell me what do you mean by research?
Research means to search again, and it is
What?
to search again and new articles or new ideas or new
Yes.
care for
Uh,
patient.
can you able to see the slide?
Yes, ma'am.
Okay, okay. Sure, research. Okay. So this is the abbreviation coming from research. RESEARCH. So R for rational way of thinking. E for expert and exhaustive treatment. S for search for solutions. E for exactness. A for analytical analysis of adequate data. R for relationship between facts and theories. Do you know? These are the abbreviation. What is facts? Any idea? So you have to discuss. Next, C for constructive attitude or critical observation or careful recording, and H for honesty and hard work in all aspects of the treatment of the data. Treatment of the data. That is your full form of research. So able to clear? Any doubt you people having? Yeah, everything is or everything is audible?
Yes, ma'am.
Okay. It is understood? So let's come to the definition of research. So research is a okay. So prior to that, let me know, is nursing education or nursing practice required research? Does it essential to do research in our profession? Yes or no?
Yes, ma'am.
So anybody can justify it by giving one or two example?
If in our nursing, if we will do research, then it will update.
Yes,
So
very
new
good.
procedure, new articles we can use, and we can give the we can give to the patient better care.
Yes, very good. Any other except Priya? Anyone can want to give her suggestion regarding research is essential in our profession? Anybody? Anyone? Can you add your opinion? Let me know. Punam, Anjali, Mamta, can you say?
Can you say one more? I
Yes.
didn't get.
Yes. So no other people have any idea? Okay. So research is essential in any aspect of our profession, like in giving update care, modern care, and not only the care aspect, but also the knowledge, the instrument, and everything. So let us discuss what is research and how it is essential for our profession. So first of all, we should know the definition of the research. So research is a systematic inquiry that uses a disciplined scientific method to answer the questions or to solve the problems. Research is also called systematic as it is follows an acceptable procedure and order. It is also a scientific as the results are verifiable. That is, if the study is repeated under the same conditions, the researcher will get a similar result. So, first definition, research is a systematic inquiry. So, why it is called as the systematic inquiry? Because it's a step-by-step process. So, first of all, from the first step, then step by step, we'll first the introduction step, then review literature, research process, analysis, then your discussion chapter. So, it is a step-by-step process. That's why it's called as a systematic inquiry that uses disciplined scientific method to answer the questions or to solve the problem. So, what do you mean by nursing research? Nursing research is defined as a systematic inquiry designed to validate and refine the existing knowledge and generate the new knowledge that directly or indirectly influences nursing practice. Are you able to get it? This
Yes,
definition
ma'am.
you understood?
Yes, ma'am.
Yes. So we can elaborate these things. Nursing research is defined as a systematic, as you know, research is a systematic process. So nursing research is also a systematic inquiry designed to validate and refine the existing knowledge. Whatever the knowledge is previously having, we should refine that knowledge. For example, previously it was said that we can 2 hourly shift the bedridden or unconscious clients in order to prevent the bed sore. But through research nowadays, it is the knowledge update. So 2 hours mean not mandatory that you should not disturb the clients. So that doesn't mean that 2 hours so patient is sleeping and will disturb the client that it is already 2 hours. So through research define different knowledge is coming. So nursing research is defined as systematic inquiry designed to validate and refine the existing knowledge and generate the new knowledge that directly or indirectly influence the nursing practice. So through research, the new knowledge are generated which can directly or indirectly influence the nursing practice. Directly means the nurse can gain the knowledge directly and apply it to the clients. Indirectly, through educations, they can learn the nursing tutors, they can educate. Then this knowledge can applied by the students or the staffs for the patients. So it is a systematic inquiry with a scientific approach. It has to be proved, it has to be proved. That's why it is a systematic inquiry with a scientific approach to find answers to the questions and to solve the problems in nursing practice and in all dimensions of nursing profession. This is the definition of nursing research. So, nursing research is the systematic inquiry into the phenomena of the interest in nursing, since it encompasses all research which pertains to the organization, delivery, use, and outcome of the nursing care. Clinical nursing research is the scientific inquiry designed to guide nursing practice and to improve the health and the quality of the life of the clients. Through research, update knowledge are coming and it will help for the improvement of the health and also the quality of life of the clients. So, clinical nursing research plays an important role in nursing in terms of credentiality and status. It brings changes in nursing practice, solve clinical problems, and helps in making also clinical decision. Then, what is the source of knowledge? There is a term that is source of knowledge. So, you should, well, we have discussed regarding what is research, what is the meaning, the definition of research, what is the definition of nursing research. Then let's know little about sources of knowledge. So you should know. So what are the source of knowledge? Anybody can. As you know, research verifies existing knowledge and discover new knowledge and advanced knowledge, and the knowledge discovered through research is scientific. As you know, research, the process that will exist, that will verify the existing knowledge, the old knowledge, and discover the new and update knowledge and advanced knowledge. So, from where this knowledge will come? Anybody? Any idea from where we'll gain knowledge?
Ma'am, from traditional base or
Yes,
all old articles.
very good.
From practical basis.
Yes, good. Okay. So there are other sources of knowledge like tradition, authority, experience. You have to also gain knowledge from your own experience as well as from your seniors, from their experience also through trial and error, through intuition, etc. We accept the knowledge from these sources without questioning, and the knowledge is quite useful to us. A critical mind can analyze, can always raise questions on the existing knowledge. So always you suppose 30-40 nurses are working in ICU, but everybody's knowledge is not same. So that's why it is written a critical mind. Some people have higher IQ, some people have lower IQ. So those are the genius or the critical mind. They are able to find different questions and they try to solve also that questions. So, after you should know little about sources of knowledge, then what is the meaning of problem solving? This also you have to know before going to other things about research. You should know what is problem solving. You should know what is scientific method, what is evidence based practice. Then after we'll go research process, review literature, research design, so and so. So, what is problem solving? Can anybody tell? Problem solving, problem plus solving. So this is the combination of these two words. So what is altogether? It means Anvesa, you can tell.
Finding out the way to solve the problem.
Yes, Mamta, you are right. So, the sources problem solving means it is a process. It explores the solution to the problem. The process through which we explore the solution to the problems. All problems don't require the application of research process in order to arrive at a solution. So, in your day-to-day life, while you are doing the clinical duty, so many problems you are going to face. But not all the problems will solve by the research. Some problems they solve by our day-to-day lives by also generally not through research. So what is these steps of problem solving? First of all, we identify the problem. So different steps of problem solving. First of all, you have to identify the problem that you are doing. What I am facing, so stress, or I have little knowledge regarding the bedside care, or little knowledge regarding less knowledge regarding ventilator care. So in that case, you have identified that I am having less knowledge regarding care of the patient with those are having ventilator. Then after you develop a hypothesis, that means you look into the cause and find cause and effect relationship. So that means you find out the cause, that this is the problem. Why I am not having that type of knowledge? I am not practicing. I am not going through any books. I am not assist the seniors during that ventilator patients. So you have to identify the cause and find the cause and effect relationship. Then you generate several solutions. Then you identify that if I will assist my seniors during ventilator care, I can also gain knowledge. If I will read many books, if I will take these clients repeatedly, taking over, then I can also have the knowledge. Or there are different classes in different department like ICU. I will attend different classes so that I can also gain more knowledge. Then so several solutions you identified. After that, you try out the best solution so that the problem is solved. You tried the best solution. So out of these five, six, or seven solution, you thought that this is the best solution, and you find out the solution and apply it. If the problem is not solved, then you retry for the next best solution. Then the research is essential to find out the scientific solutions. So when a problem occurs repeatedly with great magnitude and we cannot find solutions through our reasonings. So you understood what is problem solving and what is the process of problem solving? So problem solving is a process that requires to solve the problems. So different steps of problem solving. First identify problem, then look out the cause and find the relationship, then develop several solutions. After that, you have to apply the best solutions. And if your problem is not solved, then you should you should apply the next solutions, and you should identify the alternate solutions again. And this is the recycling process. So have you understood it?
Yes, ma'am.
Okay. So next step, need for nursing research. Why in our profession nursing research is essential? So first of all, to develop, refine, and extend the scientific base of professional knowledge which is required for quality nursing care, education, and administration. Not only in clinical care, but also in nursing teaching and also for administrative purpose. This nursing research is essential. Then enhance the body of professional knowledge in nursing. Then provides foundation for EVP practice. So, what do you mean by EVP? The full form of EVP?
Evidence-based practice.
Good. That is your evidence-based practice. Help in expansion of knowledge which is essential for continuing growth of nursing profession in enhance their professional identity as research is essential component of any profession nowadays. Research is going on in every profession, like in pharmacy, in medicine, medical profession, in engineering, whatever the profession you are going to see, there is research. So define the parameters of nursing, which will help nurses to identify the boundary of nursing profession. Through research also, the boundary, where is our boundary? Up to which area we have to limit. This is also due to, that's why nursing research is also essential. Then refine and eliminate old knowledge. The old knowledge, we have to eliminate it. We have to refine that knowledge through nursing research. Existing knowledge will come, update knowledge will become, and that old one we have to eliminate. Identify nursing care practices that makes a difference in healthcare status of individuals and are cost effective. So nowadays, evidence-based practice or through research, so the knowledge and skill of the healthcare professional and the healthcare status will be maintained. That's why it will also cost effective for the clients. It enhances accuracy of different nursing educational and administrative technique, develop and define nursing theory and principle. It solves the problem or answer the questions related to nursing practice, education, and administration. So, what are the characteristics of a good research? So, good research. What is the meaning of good research? Anybody? Any idea? So, you have already touched regarding research in your basic level. Yes or no? All this is totally new for you. Tell me. All of you from BSc or GNM or master degree, you might have mixing all this profession. Yes or no?
Yes, ma'am.
Okay, whatever it may be. So characteristic of a good research. So many researches are carrying on or going on. Not all the researches we called it as good. So for a good research, there must be fulfill certain criteria. Okay. So let us have a discussion regarding what are the characteristic of a good research. So it is the scientific findings of a good research study are verifiable. It should be verifiable. If you verify the study, then accurate things are coming. Then systematic approach. As I have told, it is a systematic approach because there is a steps of nursing research. We have to go through it, and then after you can understand how it is a systematic approach. It is an orderly approach, orderly, step by step. Then controlled, other criteria are controlled. Factors not under study but which may affect the study are controlled. So for a research, there are many criteria. So if you are going to, I'm giving an example. If you are going to do a research, that is an knowledge assessment of the basic fourth year students regarding the AIDS super is whatever, what are the knowledge the students having regarding AIDS, you have to assess. That is your problem statement or that is your research. So for that, control means the factors not under study but which may affect the study. That means if someone will doing copy or cheating, like that, this is a factor. So if the students are doing cheating, then you cannot find the exact assessment. You cannot do the exact assessment, knowledge assessment of the students. That is the control factor. Then objectivity. So what is objectivity? Anyone can tell? So it is based on objectivity, goals. Any research has the goal. Goal means You know it. Without the objective or goal, research cannot be done. Then generalizability. So generalizability, it means finding the study obtained from sample is applicable to larger population or from the situation studied to a larger population. So there is inductive and deductive reasoning. Generalizability. That means if I am going to do a research that the effect of jamun, so for example, I am doing a research that effect of jamun seeds powder on management of diabetes mellitus, uh, in managing the blood sugar of the diabetic mellitus clients. So, are you able to understand the problem statement? There is a study. My study is that I am doing a study on the problem statement is that effect of jamun seed powder on blood sugar level of the diabetic clients. Have you understood?
Yes, ma'am.
Yes. So under that, whatever the findings I will get from my study, that at conclusion, I had drawn the conclusion that this jamun seed is effective for the patients, those I have taken during my study period. Suppose I have taken 30 clients, and by applying these jamun seeds for 2 months, I have seen that jamun seeds has a greater role in managing the sugar level of that clients. So this is the conclusion of my study. I can generalize it. That means these jamun seeds can apply for every diabetic clients and it can manage the blood sugar. Able to get it? This is the generalizability. Understood or not? Not getting. Again, I am clarifying it. Suppose whatever the my study, I have got conclusion from my study that jamun seed has a great role, or jamun seed reduces the blood sugar of 30 diabetic patients which I have taken for my study. You understood this sentence, the meaning of this sentence?
Yes, ma'am.
Yes. Then after drawing this conclusion that if these jamun seeds can benefit for 30% upon which I have studied, as a generalization, I can utilize it that this jamun seed can be effective for every patient, for every diabetic patient. So, jamun seed can be applied to the diabetic clients as it controls the blood sugar level. Okay. So, this is a generalization. That means for a larger population. Okay. It can be applied for a larger population because whatever the findings it is written here, it means the findings of the study obtained from the sample, that means from your study, is applicable to the larger population from situation studied to a large population. For example, I am giving whenever the COVID-19 vaccinations come, okay, so before COVID-19 vaccination, there is a trial method. Can you remember?
Yes, ma'am.
Yes. So what does they did? The scientist, what does they did? They first apply different different stages in different patients, like 500 patients or 1,000 patients, isn't it? Yes or no?
Yes, ma'am.
So whenever they are getting the good result, no side effect, then they declare that this vaccine is safe and can be given as mass immunization. Yes or no? That is the generalizability. Can be applicable for a larger population after doing the examination. Are we clear now?
Yes, ma'am.
Yes. So there is a inductive and deductive reasoning. So inductive means that is from, anybody can tell what is inductive and what is deductive? Anyone? Let me know. In inductive reasoning, the researchers looks at the various factors and puts them together to give the meaning. And in deductive, researcher looks the total situation and identify the parts. That means from whole to part is your deductive, and from part to whole is your inductive reasoning. Okay. So many things we have to proceed. So it will be take time. You go after the class, you study. If not understood, then clarify from us. So next, we have covered what is research, meaning the abbreviation, what is the definition of research, what is nursing research, what is the sources of knowledge. Then we also gain some knowledge regarding what is the problem solving. Then after that, characteristic of a good research. Then importance of need for nursing research. Then after, we have to go through scientific methods. So students, can you able to explain what is the meaning or what do you mean by scientific methods? Anyone?
Which is proven by the science.
Yes, it should be proven rationally. Yeah? So, scientific methods are defined as controlled, systematic investigations that are rooted in objective reality and that aim to develop the general knowledge about the natural phenomena. Okay, this is controlled systematic investigation. Why it is controlled? Because the experiment is going on, isn't it? We have to observe the situation under our control. We have to keep boundary for that. That's why it is the defined as a controlled systematic investigation that are rooted in objectivity reality and aim to develop the general knowledge about that phenomena. So, what is the characteristic of a scientific method? Like research process, it is orderly process, it is systematic process, and the scientist, those are applying the methods, attempt to control the external factors that are not under direct investigation. Are you able to get this point? So, while doing certain experiment, different external factors can influence the study. So they have to control that external factors. Their findings are based on empirical evidence, means knowledge evidence. Findings of scientific methods can be generalized. Whatever the methods they can got from the experiment, they can generalize. That means they can apply it for everyone, which means they can be used in situations other than the one under study. Scientific methods are based on assumptions or hypotheses. So, what do you mean by assumption? Assumption कौन हमें पढ़िबा research रे. We assume. So, different assumptions. We assume means we guess. Example, we assume that the earth is what? Round. Hypothesis. Hypothesis are the statement. That is the, what is that? Anybody can tell what is hypothesis? Yes? Previously, have you gone through it?
Hypothesis is assumption.
Huh? That should be
Are
that should be tested through research process. Okay. जो assumption ताको हमें कौन करिया टेस्ट करिया दरकार टेस्टेड करिया through research process. Okay, that is your hypothesis. So hypothesis is a formal tentative statement. It is a statement, okay, of the expected relationship between two or more variable under study. So hypothesis is a tentative prediction or explanation of the relationship between two or more variables. For example, hypothesis ଆମେ କାହାକୁ କହିବା? Suppose example କିଏ ଦେଇପାରିବ? So every the sentence or the tentative prediction which has to be proved through research process. The problem, so we have to see what is that hypothesis. So next, what is the purpose of scientific? So in one class, actually it is difficult to clarify all these things regarding this research, but you have to gain as much as you possible. Then after, if it's any doubt you people are having, can clarify from us also by WhatsApp or by calling. You can clarify your doubts. So what is the purpose of scientific methods? The basic purpose of scientific methods are description, exploration, explanation, prediction, control, prescription, and identification of relationship of the facts. So we should go a little bit too fast because so many things we have to cover. So steps of scientific methods. Actually, this is in one class. It is very impossible to complete all over total research. So as much as possible, we should try cover these things. Steps of scientific methods: selecting the topic, identifying the research problem. First of all, you have to identify the problem. Before that, you have to select the topic on which you have to going to do the apply the scientific method. Define the objective of the study. Review the literature. Review literature. We'll discuss it. So reviewing literature means in roughly what you understood.
Previous study regarding the topic.
Yes. So previous study regarding your from known study, that is define concept and variable to the studies, stating hypothesis about expected observation or phenomena to the study. Determine the ethical implications of the proposed study, describe the research design and method, define study population. The step, these are all in the research process. The steps of research process will also follow. Then data collection, data analysis, then analysis interpretation, then study findings communication. So first of all, identification of a problem. Remember as much as you can grasp. So identify the problem. Setting goal or objective. This is your, for example, I am giving, so guess me one problem. You have to choose. For example, you identify that the effect of early ambulation on the patient going under surgery, abdominal surgery, or lower LSCS. Your topic is, select the topic. Here your topic is, what is your topic? You can say here, effect of early ambulation upon LSCS patients. Early ambulation, you are getting the meaning? Are you able to understand what is the meaning of early ambulation?
To get out from the bed.
Yes, as much as possible. Early ambulation means as much as possible, you have to walk or get out from the bed and do some mild exercise, walking. So we have to study our topic here, select the topic here, the effect of early ambulation on lower segment cesarean section, and identify the research problem. So here, your problem statement is that a study, an evaluative study under effect of early ambulation on lower cesarean section patients in MKCG hospital. So define the objective of the study. Your objective here, you can write, first of all, to identify, first objective, to identify the LSCS patient. Second objective, to apply early ambulation. Third objective, effective. The early ambulation has a better effect on healing of the wound. So these are the objective. Then reviewing literature. Reviewing literature means here you have to go different studies previously done regarding early ambulation and effect of surgery. So define concept and variables also. Then hypothesis. Hypothesis here you can write the it variable to variable. Variable means which can affect the varies which can affect the research study, like dependent variable, independent variable. Independent variable is your cause and dependent variable is also the effect. For example, here in your study, early ambulation is cause or effect, we can say.
Is the effect.
Huh?
Is effect.
No. Early ambulation is cause. Effect is better healing. Okay. So here, that is variable you have to identify. Independent variable, dependent variable. And stating hypothesis means you can, your hypothesis, you can here can able to write that null hypothesis and alternate hypothesis. In null hypothesis, what is that? You can write early ambulation does not has a effect in early wound healing. In hypothesis 1 by 801, you can write by alternate hypothesis, early ambulation has a effective or great effect on early recovery of the LSCS patient. Like that, two hypotheses you can write. Whatever the assumption, you can, your prediction, you can write in the form of the sentences. That is your hypothesis. Are you able to get it? Understood?
Yes, ma'am.
Yes. So after hypothesis, ethical implication of the study. What does it mean? Ethical implication means
Scientific cause is present.
no. Another one we can say ethical implication.
It's legal.
Yes, legal means where you have to get permission from the patient, from the hospital authority. If we are doing study in a medical college and hospital, so from hospital superintendent, you have to apply it for the permission. Before that, ethical committee. If the hospital has ethical committee, you have to also get NOC for that. These are the ethical boundary for that study. Then you have to describe the research design. There are different research design, quantitative, qualitative. We have to discuss in the next chapter. Then define the population. You have to identify population. Here your population is LSCS patient and sample. Those are admitted in the MKC's
Hospital.
hospital. That are your sample. Then after that, you have to data collection of data. After that, data you have to form tools for data collection, different questionnaire or interview. You have to collect the data. After that collection, data analysis. After data analysis, you have to here planning for data analysis. After that, after planning, you have to collect the data, analyze and interpreting the data. After analysis, by using different statistic methods, that is different inferential or descriptive statistic method, you have to obtain the result, and that after you will communicate this finding of the study. The conclusion you draw that I have taken 30 LSCS patients and I am also giving them early ambulation therapy. So as a conclusion or at the end of my study, I have seen that early on 20 or 25 percent, I have my study is effective. That means ethic percentage, this percentage, the ratio have already drawn, and my study is effective that is early ambulation, has a great impact on early recovering of the clients. So this is all about the steps of scientific methods. So these are methods also applied in the research process. So what is the limitation of scientific methods? So limitation means, what is that? What is the meaning of?
Barrier.
Yeah?
Ma'am, limitation means barrier.
Yes,
You have to
boundary.
stop.
Some boundaries. So first one is your moral and ethical problem. So moral and ethical problem, what does it mean?
We does not do which is unethical or which is harmful to the patient.
Hmm. Then ethical, moral, which is not hurt to the moral of the clients. Then human complexity. What does it mean? Human complexity means, what is the meaning of human complexity? Human complexity means human behavior, human natures are very complex. That is not a perfect or a fixed one. The emotion you have seen now is vary in different situations, and also people to people will vary. So if you are studying, you cannot find a fixed emotion or things at a one. That's why the study will be vary. The result will be interpreted. Then measurement problems. The emotions, suppose we are going to study certain things that will be difficult for measurements. Then sometimes external variables control problems. Sometimes we cannot control the external variables. That is also a very problem to scientific methods. Okay. Here, human behavior is complicated, subtle, varied, very difficult to categorize human behavior. When human behavior is studied and analyzed by other human beings, the personal biasness may occur. Picture, distort, etc. Okay. So next, what is evidence-based practice or EBP? Evidence-based practice is an approach that enables the clinicians to provide the highest quality of care in meeting the multifaceted needs to their parents and the family. So the definition, coming to it, evidence-based practice, in short form, you can write EBP is the process of making clinical decisions based upon evidence combined with clinical experience and patient's expectation. Evidence-based practice is the conscientious, explicit, and judicious use of current based evidence of in making decision about the care of the individual patients. The practice of evidence-based medicine means integrating the individual clinical expertise with the best available external clinical evidence from the systematic approach. Research. So through research, the evidence-based practice means through research, the practice of best medicine or best care to the individual, which is coming from your research process. So this is your evidence-based practice. Evidence-based practice, best clinical expertise, patient value and preference. You have to give patient's value and preference, and best research evidence out of many research. What is the best result that you have to apply it? Then aims of EBP to provide the high quality and most case efficient nursing care possible, to advance quality of care provided to the healthcare worker by the healthcare worker, to increase satisfaction among the patients. Definitely, if we'll provide best care, then best satisfaction by the patient will come. The focus on nursing practice away from habits and tradition to evidence and research. It results in better patient outcome. It contributes to the science of nursing. It keeps practice current and relevant. It increases confidence in also decision making. Objective and purpose of evidence based. Like that, evidence-based practice seeks to replace practices as usual with practice guided by rigorously outcomes-oriented research. Identify randomized control trial. A randomized control trial means kona? Every patient has the sample. By giving the sampling, we have to give every patient has the option to be the sample. That is the randomization. Okay. So it also seeks to make practice less subjective to enterprise and to rise it to higher level of accountability, reduces the variation in nursing care and assist with efficient and effective decision making. It provides practice to the nurse, evidence-based data to deliver effective care. Need for ABB, for clinical judgment, for updating knowledge, for improvement patient care, to provide the framework for understanding the evidence-based practice. The steps of evidence-based practice, like scientific method, define the question and evidence-based resource to answer the question. That means reviewing literature, then evaluating the strength and applicability of the evidence, which one is best, you have to analyze that, then apply that, then evaluating the steps. Last one is your evaluating steps. So you have to, the evidence-based follow the PICO, that means the patient population interest, I for intervention of interest or range of intervention, C for comparison of intervention, O for outcome. Evidence-based practice re patient population, which interest you have to give interest on which area you are going to do study. Then intervention interest, that is evidence means intervention is there. Then comparison, after giving intervention you will compare then outcome. For example, जोटा मु देइथिले already effect of early ambulation on cesarean patients outcome, patient population, that is your interest. You have taken the interest to take LSS patient, you have to give intervention, give treatment, that is you have applied for that early ambulation. Then comparison, you have taken two groups, one control group, another is your um, intervention group. Control group, you have 15 control group and 15 intervention group. In control group, no intervention. That you have taken only 15 patients, no early ambulation is given. And in another group, that is you have taken 15 patients, give ambulation. After that, you assess. Then you can compare the outcome and outcome of interest. That is, you got the result. Then barriers of evidence-based practice. What is the barrier? Lack of value for the research practice. Lack of value. You don't give any value to your research practice. Some hospitals, they don't give any importance for the research, just they are giving. And some hospitals, there is medical college and research centers. So for that, evidence-based practice, for that lack of value for research should be given. Difficult in bringing change, lack of administrative support. Without administrative support, no evidence practice best practice should be applied. Then lack of knowledge, that is proper knowledge of the staff is essential for doing evidence based practice. Lack of time for research, so nowadays every staffs are busy, there is a lack of manpower and proper research and practice is not going on. So many nurses have not received any formal instruction in research and they lack skill to judge the merits of the study. The non-ability of a research reports which are not easily gathered, complexity of research regarding evidence-based practice, organizations have failed to motivate or reward. Some organizations, they only have the mentality that only to provide patient care and do some income. So in this way, no research work should be done, and certain organization in you can also give if you go to certain corporate sectors in teaching or hospital sites, the organization encourage the people do some research work. If you don't do any research work, then no promotion will be or no reward will be given to you. So these are the policy also fulfilled by certain organization. There is a shortage of role model nurses as it is a main cause shortage of the nurses. So they are doing the duty, also not properly, their lack of time, lack of manpower, they are not providing care properly. So how they will provide the research work? So these are some barriers to evidence-based. Then what are the advantages of evidence-based practice? Informative explores. Knowledge will explore better patient outcome, increase efficacy of the nurses, efficiency of the nurses will increases, making decision based on knowledge that is backed by research, and keep nursing practice current to the new trends and update guidelines of the care. It also promotes high quality and cost effective care. Evidence based practice to provide care to the patient increases the nursing confidence. By providing EBP, also, the knowledge has to be built their confidence. Okay. So these are all about the scientific methods, evidence based practice, sources of knowledge, problem solving approach, research, and nursing research. Okay. So any doubt from this? Any doubt?
No, ma'am.
Okay. So are you able to write if there is short note? Can you write what is evidence-based practice? Scientific methods, short note if come. Are you able to write? Actually, in one class, it is impossible to cover all these things. So I'm trying my best to clarify as much as possible. Okay. So next we have to discuss what is literature review. In every actual the research process, there is 5 chapters. So in your course, is there any research work? Have you know? Yes or no? Okay, whatever it may be. So, can anybody tell me what are the steps of nursing research? Formally, before you have already taught this about the research process. So, are you able to tell me what are the steps of research process?
Assessment, diagnosis, planning, intervention, evaluation.
No.
Identify problem, define objectives, reviewing literature,
Very good.
code theory, and then define concepts.
You are telling by mixing all these things, isn't it? So actually, 5 chapter is there in any research process. 5 steps. So chapter 1 is your introduction. Chapter 1. Okay. In introduction, that is your problem statement, your objective, your assumption, hypothesis,
Hypothesis,
and then what
review
other?
of literature.
Nah, these are all about background, need of the study. This is in chapter 1. And in chapter 2, what is that? Review literature. Okay, in chapter 3, that is your methodology by research design. The which method, the sampling and research design. And chapter 4, that is your analysis and interpretation. And chapter 5, discussion, conclusion, etc. Okay, whatever the conclusion you got from your research. So let us have discussion regarding literature review. So what do you mean by review literature? Any idea? You have already told so many points.
Ma'am, from the books, from the old books,
Yes, from old books. From any other things, we have to collect the literature review.
What has been already established or published on a particular research topic?
Only not published, also from unpublished journals, books, you can
Yes.
collect the.
Print, online, or journals.
Yes, very good. So, literature review. What is that literature review? Review of literature is one of the most important steps in the research process. It is an account of what is already known about a particular phenomena. The main purpose of literature review is to convey to the readers about the work already done and the knowledge and idea that you people have already established on a particular topic of research. For example, you are studying regarding the LSCS patients and early ambulation. So you can search that different study on LSCS, early ambulation. You can type and can find so many studies have already done previously before you. So literature review is a laborious task, but it is essential if the research process is to be successful. Out of research, actually, this is very boring things and it is also very laborious because if you go through the study, you can find so many pages are there in a literature review, and while you are writing your review of literature, you have to only write the name of the author and the year of doing the study, and what is the methods or methodology they are following, and what the study outcome. Okay, only this much you have to write in your review literature. So in chapter 2 of the research paper, by your thesis paper, that is a review literature, you have to follow, you have to identify so many literature regarding your study. You have to write that these are the study done by this author in this year, and they applied this method of research, and their study results are so on. So this is your review of literature. Under definition, according to S.K. Sharma, the the literature review is defined as a broad, comprehensive, in-depth, systematic critique and synthesis of scholarly publication, unpublished print and other material, audiovisuals materials, and personal communications. According to University of Toronto 2001, a literature review is an account of what has already been established or published on a particular research topic by accredited scholars and researchers. The review literature is a body of text that aims to review the critical points of knowledge on a particular topic of research. Okay, so these are the different definition of review literature. So what is this importance of this literature review? So give your suggestions. Is it important, review literature, for a research study?
To gain knowledge, previous knowledge.
Then, okay. It identify of a research problem, development, refine of research questions. It generate useful. Before that, I'm only clarify your doubts here that if I am taking in my research work that effect of early ambulation on LSCS patients, I have to go through many study, and in different study I can have, there are in different sites online also many complete thesis, 100, 200 pages thesis are available in online, in PubMed, in Signal, in Google. By studying this, so many theses, you will have an idea regarding how a problem statement is written, how the research design will be taken, then how, which type of statistical analysis which we apply, and how we will write the literature. You can have an idea regarding the thesis completely. Okay, so that's all about the things written here. Generation of useful research questions or projects activities for the discipline. From review literature, you will have an idea how the research problem will be written. Orientation to what is known and not known about area of inquiry of ascertain what research can be best contribute to the knowledge. The what already known and which is already not done. Then determination of any gaps. So if many things are done, these are the things which have done from this research, and these are the things not done. Then the gap, you have to find out the gap. That means on which area there is no study. You have to identify, you have to discover of unanswered questions about the subject, concept and problems that determine of a need to replicate a prior study, different study settings of different sample size. You will have idea regarding study sample, how you take sampling, study settings, population. You will have a better idea. Then you will have identify relevant theoretical conceptual framework for a research problem. For doing a research, you have to identify different framework. So from research, you can identify these different models, different theory like Roberts theory, King's theory model. Then different model and theory will be applicable, and framework will be done. And in chapter one, conceptual framework. So you will have done an idea how this framework will be done. Then strength and weakness of the study will able to understand. Then development of hypothesis to be tested in a research study helps in planning methodology. You will have the knowledge regarding which method they applied and which method I will apply for my study. Then development, it will help to development of research instrument. So what do you mean by research instrument? Let me know what is research instrument.
Research tools means checklist.
Research tools. Yes. Instrument means the device from which we have to collect the data. It may be questionnaire, it may be interview, it may be different mechanical device like your BP instrument, like your glucometer, like your hemoglobinometer. It will collect, it will assess the hemoglobin level of adolescent girl. So here, your instrument is here what? Hemoglobinometer. It will identify the sugar level of a diabetic patient. Here, your instrument is glucometer.
Glucometer.
Okay. Then, okay. Anyone is telling anything? So next, identification of suitable design and data collection method. From this review also, a researcher can identify which research design will be applicable for her study or his study, and which method of data collection she has to apply. Then what is the purpose of review? We have to skip all these things one by one. The purpose of literature review is to convey the reader previous knowledge and facts about the topic, strength and weakness. Literature review allows the reader to update with the state of research in the field and any contraindication that may exist with the challenges finding other research. Are you also able to find out in previous study anybody have faced any problems, any challenges? You have to identify and you have to rectify it from your study. It helps to develop research investigation tools and to improve research methodology. From that, you have to identify their strength and weakness, and you have to identify or improve it in your study. Besides enhancing researchers' knowledge about the topic, writing a literature review helps to the place is in the context of the contribution to the understanding of the subject under review. Describe the relationship of each study to other research study under consideration. Identify new way of interpreting and shed light on the gaps of previous research. Here I'm a discussion already. We have discussed these things. Then point a way forward for further research. See what has and what has not investigated. From review literature, you have to identify what are the things already done and what things not done, and you will do for that, which that is the gap. So you have to see. Then what is the sources of literature review? From where? You have to search the review sources. You have already discussed all these things. The literature review can be divided in the two sources, that is your primary source and secondary source. So primary source, what is that? What is primary source?
Which is original and peer review, peer group.
Yes, very good.
Which we get.
The source, the data, the things you have to collect from the researcher who have conducted the study. Okay, the original researcher. From if you follow his own thesis that done by the researcher himself, that is the primary source. Secondary source other than the researchers. Okay. So primary sources, the literature review mostly relies on primary sources, that is research report, which are description of the study written by the researcher who conducted them. A primary source is written by a person who developed the theory or conducted the research, or is the description of an investigation written by the person who conducted the study. Most primary sources are found in published research. Okay. For example, given here. So next, secondary sources. As I have already told you, the secondary sources, that is the research document, a description of study prepared by someone other than the original researcher. They are written by people other than the individual who have developed or conducted the research. Okay. These are the main source of review literature. That is from books, from different journals, from conference papers. Nowadays, different conferences are going on in physically as well as virtually. So in that conference also different papers, research papers, the researchers, they are presenting their research paper and also awarded to them. So different thesis, encyclopedia, Wikipedia, from dictionary, from research report, from magazines, newspaper, and from electronic database. These are the main sources of review literature. Clear? Shall I proceed? Am I audible?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Okay. So the electronic sources, as you know, these are the very popular things nowadays. Even if we don't, we are in such a century where remaining that we never follow any books or magazines or journals. We are everything we are following through online. So these are the electronic sources. Computer-assisted literature search has revolutionized the review of literature. These searches, however, for a variety of reasons, may not provide the desired reference. Electronic literature search through web may be very useful, but sometimes it can be time consuming and unpredictable because there are many websites and web pages that can also lead information overload and confusion. So if you search one thing, so many things are coming and you have to confuse to which you have to follow. So these are some sources for like Yahoo, www.yahoosearch.com, Google, www.google.com, then Signal, the cumulative index to nursing allied health science. For that, http www.signal.com, PubMed, http pubmed.com. So these are the different sites for online search. Then Medline, like PubMed, these are the sites given here and the group, everything is there. You have to follow. Then Registry of Nursing Council Research. This is also another online site for searching the different nursing research like www.nursinglibrary.organization. Then Psychoinfo, psychological. This is by American Psychological Association to convey literature, different psychological related discipline. Psychoinfo. Then different online journals. These are the links you have to follow for reviewing literature. These are the journals of online. So clear? These are the www.aidsinfo.ne.government, that is HIV and AIDS information. For that you have to follow these sites. And then hazardous agents for the to getting information you have to search www.hazmap.nlm.government. Then health information find www.combined health information database child.ne.government. Then cancer ପାଇଁ for cancer literature embase extra medical database ITHO. So ITHO called alcohol and alcohol problem science database, health star, radix cd-rom. These are different sites for reviewing literature. Then printed source. There are different printed materials available. So printed are nursing published, located from published abstracts such as nursing research abstract, psychological abstract, dissertation abstract, international, master abstract, international. Then allied nursing index to nurse, cumulative index to nursing and allied health literature. These are also coming in the form of a printed material. Nursing studies index, index medicus, then different national and international journals. So these are the name of some national journals and name of certain international journals. Nursing and Midwifery Research Journal. These are under national journals. Indian Journal of Nursing Research and Midwifery, the Nursing Journal of India, Nightingale Nursing Times, International Journal of Nursing Education, Indian Journal of Nursing Studies. So next, nursing research, research in nursing health, nursing science quarterly, Western Journal of Nursing Research, applied nursing research, biological research of, for nursing, advance in nursing science, clinical nursing research, worldwide on evidence-based nursing, Journal of Qualitative Research, American Journal of Nursing Research. So these are all about the review of literature. Then steps. I will follow different steps. So bibliography, thematic presentation, then more reading, then write individual sections, then integrate these sections. Review for writing review of literature, three things is essential: introduction, body, and conclusion. So first you have to give little bit introduction regarding the study, then body, that means which methodology they have applied, that is under your body, and conclusion, what is the result they are getting from the study. So these are the things or elements for a review literature. Then introduction, how you will write. Define or identify the general topic, use, issue, or area of concern. Provide appropriate context for reviewing the literature. Point out overall trends in what has been published about the topic or conflict in theory, methodology, evidence, and conclusion. Establish the writer's point of view for reviewing the literature. Explain the criteria to be used to analyze and compare literature and organization of the study. So main things here, you have to define, identify the topic, issue, area of concern, providing the context, point out overall trends, what has been published. Okay, so what is the theory, which methodology, evidence, and conclusion. So these are things you have to done in the introduction. Then body part, in body, so you have to only group research studies and other type of literature according to common denominators such as qualitative versus quantitative, conclusion of author, specific purpose and objective, chronologically, so on. Then here actually assist the reader with a strong umbrella sentence and beginning of the paragraph. So here you have to only write the body, means only the methodology here you have to write. So in conclusion, actually summarize, evaluation. So in overall introduction, that is regarding the study, in body regarding the methodology, and in conclusion you have to identify what is the outcome. So within three parts, that is your main parts of the review of literature. Like that, you can see a review. Like that, it is written here. What example they see? Adams, Kotle, and Padgett. They are the author. And in the year 1983, noted that 13% of women studied said that they avoided taking a class or working with certain professionals because of the risk harassment. So next you have to go, because all these things we should cover in the little time. So next step we have to go research process. So what is research process? The phases of research process. In a research study, the researcher progress in a logical sequence of the predetermined steps. So that is the research process. So different research processes are, these are the steps of research process. You have to go through that. So how many steps are there? Yes.
5 steps.
So what are this? First one is,
5 phases.
let me tell from you.
First one, conceptual phase.
Huh?
These are the include thinking, reading, rethinking, and reviewing idea with the colleagues.
Yes. Next.
Next one is
Design and planning phase.
Yes. Good. Next step.
Empirical phase.
Empirical phase. Okay. So next phase,
The analytical phase.
analytical phase. Next phase,
Disseminated phase.
yes, disseminated phase. So actually, we have already discussed little bit about this phase, isn't it? Overall. Okay. So first coming to conceptual phase. So somebody can read it. What is conceptual phase? So out of 5 phases, that the research process has 5 phases: conceptual phase, designing planning phase, empirical phase, analytical phase, and dissemination phase. Coming to conceptual phase. In conceptual phase, first one, formulate research problem. So this is your chapter 1, phase 1, research problem formulation, study objectives setting, review literature, develop a theoretical or conceptual framework. So identifying study assumption, acknowledge the limitation of the study, then formulate the hypothesis. These are all about in conceptual phase. So detailed. So only I am telling the main points. The inner parts you will go through it because it will difficult for finishing all these things. So from the you can have idea formulating the research problem, isn't it? That means what is that?
Identification of a problem and make a research problem.
Yes. So these things from formulating research problem to define objective. After that, suppose for example you have taken a topic regarding effectiveness of jamun seed powder on diabetic patients. So this is your problem statement. Then objective is that the jamun seed may reduce the blood sugar level. Okay, then review literature means you have to go through different online sites or printed materials, that is different study regarding jamun seeds diabetes or only diabetes. Okay, then after theoretical or conceptual framework, this one little difficult for you. There is a framework. You have to develop a model by following previous theory. Okay, then study assumption. You have to assume that assumption. You have to write different sentence that this jamun seed powder may reduce the blood sugar level. This is your assumption. Then limitation. That means that you have to write different limitation of your study. Like that, your study is limited to chronic diabetic, chronic hypertension, chronic kidney disease. That is a boundary of your study. You should not take that type of population in your study. Then formulate hypothesis. You have to make alternate hypothesis or research hypothesis. Like the hypothesis, null hypothesis means it is written in such a way that this jamun seed powder may not there is no effect of jamun seed powder on reducing the sugar level of the diabetic gland. This is the null hypothesis. Then alternate hypothesis, you can write the jamun seed has a great effect on reducing the blood sugar level. This is a tentative sentence or statement that is written in the form of hypothesis. So this is a first phase, then second phase. Second phase called design phase. So design phase first you have to identify your variable. So somebody should read loudly. What is that? Anessa, you read?
Yes, ma'am. Construction of research design. Firstly, identification of variables. And first, variables are identification is must be done for research, and then construction of operational definition, then selection of research design, then developing protocol, and then selection of study population, selection of samples, and development of tools, and specify methods of to measures the variables, and lastly obtaining ethical approval.
Okay. So everybody understood?
Yes,
Yes,
Yes.
ma'am.
In design phase, first of all, you have to identify the variables. There are different variables like your dependent variable, independent variable, extraneous variable. You have to identify that variables. Okay. So after that, construct operational definition. In research, you have to write the operational definition means each and every meaning of your problem statement. Regarding, suppose the problem statement is that the effectiveness of jamun seed powder on blood sugar level among the diabetic client. This is your study. So operational, the problem statement to you totally define each terms. That is your operational definition. That means you can define what is jamun seeds. So jamun seeds are you can describe what is effect. You can write the meaning of effect. You can write the blood sugar in your research paper also. You have to write. There is a term operational definition. It includes all the meaning of your basic terms of your problem statement. Clear?
Yes,
Yes,
ma'am.
ma'am.
Then select a design. There are different design. So you have to identify who is design, whether you will adopt experimental design or a quantitative or qualitative design of your study. Okay. Then study population protocol, developing protocol. Then select a population. You have to identify on which people, whether you are going to take diabetic population, whether you are going to take which population you have to identify. Then sample. Sample means, so sample is a subset of population. Okay. Suppose your MKCG hands are your samples. Then development of a tools. Your research instrument you have to develop questionnaire or interview or glucometer. You have to develop the tool. Then ethical approval. Ethical approval from where you will get? Hospital authority, from the patient, from the ethical committee. Okay. And if you are doing study in the community area, you have to get permission from the BMC. Okay. Then after design empirical phase. So what is this phase? Third phase is your empirical phase. So in empirical phase, what we'll do?
We'll do pilot study.
So what is pilot study?
Pilot study is a small study on the research design which we are planning to do it.
Yes. So why it is done?
Um, um, to identify that we'll be facing any potential problem with the design which we have selected.
Yes. So then it is a small study. For example, your sample size is 40, but here you can take the sample size 5 or 10. By it is a small study, it is a mini study, like your main study. Before doing your main study, you have to do this small study. And one thing is important, that is the sample should not be overlapped. Those samples you are taken for the main study, that should not be included in the pilot study. Okay. Because there will be error, the study error will be there. So that from pilot study, after completion of the study, you are able to find out the limitations, the barriers, the obstacles, and you are able to correct it in your main study. Okay. Then prepare research team collecting data, then prepare data for analysis. This is your third phase. Then next phase, that is your analytical phase. The analytical phase, that is your analysis of data, interpretation of the data. Then dissemination phase. Okay. So this is all about your dissemination means kona?
We'll share our research findings with the with journals or articles.
Okay. So there is another things, research design. Okay. So research design, overall, before that we have to study on sampling, population and sample. This is all over research process. So you have to know little about what is sample and what is this research design. Overall, I will tell one thing. So what is research design? A research design is a plan, structure, and strategy of investigation for answering the research question. It is the overall plan or blueprint the researcher select to carry out their study. Okay. So elements purpose you can write to provide answer to research question to control variance. So these are all over the research design. So are you able to see the slide?
Yes, ma'am.
Okay. So what is it written here?
Designs of research.
That is
Qua-
quantitative, qualitative, and mixed. Okay. So design is three types. First one is
Quantitative design.
quantitative design. Next one is qualitative. Third one is mixed method.
Mixed
So
method.
in quantitative research design is classified into two types. One is experimental. Another is
Non-experimental.
Non-experimental.
non-experimental. And the qualitative, then the experimental is classified into true experimental, quasi-experimental, and pre-experimental. Okay.
Okay.
Then non-experimental, what is that? Descriptive, correlational, developmental, epidemiology survey. Then qualitative, case method, ethnography, phenomenology, grounded theory, participatory action research. Then mixed method, your embedded research, your explanatory, exploratory, and triangulation. This is all about your research design. Okay.
Yes, ma'am.
So let's come about quantitative and qualitative. So experimental and non-experimental. So first comes to true experimental. So quantitative or qualitative with the difference कौन?
Quantitative research deals with the numbers, like we'll get the numbers at the
Numerical.
end.
Yes,
And qualitative is about the words or the meaning, um,
quality, the behavior.
quality of the
So
design.
yes.
Yes.
Then experimental, non-experimental. Experimental under the true experimental. Pre, post, factorial and cross. So first is it true experimental, quasi experimental, pre experimental. So experimental is three types. That is true, quasi and pre. So experimental has three criteria. What is this? RC, RCT. Yes or no? Identify cause and effect relationship. Cause, effect. ଆମେ so cause and effect. That means treatment. That means therapy. People will provide that is cause and effect relationship. Researchers are active agent, not passive observer. Answer questions about the effectiveness of intervention. Gold standards for evidence-based practice. So evidence-based practice ର ଗୋଟେ standard it will maintain. So true experimental. These are the RCM or RCT, randomization, control and manipulation. What is this? So what is the meaning of randomization? I'll little bit go over sampling so you can able to understood. So randomization means,
I'll randomly pick the samples.
that means every subject has the chance to be the sample. Okay.
Exactly.
So randomization, how it is done? By lottery methods, by head and tail methods, by putting the dice on the floor. You will choose the sample. Okay. Then control. Control means the experimenter introduced control over the experiment situation using a control group. That means there is a control group, another is a experimental group. There is a two groups and there is a comparison between the control group and the experiment groups. The experiment to which we have to give the intervention, and another group we never will not give the intervention. After that, we will compare these two groups and find the results. Then manipulation. Manipulation means we have to give the treatment, manipulate, give therapy. That is the, so these the true experimental has fulfill all these three criteria. Okay.
Okay, ma'am.
That means which is a true experimental group. The true experimental design means it will follow all the criteria. That is, it has RCT, randomization, control, and treatment. Able to understand?
Yes. Yes, ma'am.
That is true experimental. If three criteria are present, that research design is a true experimental design. Clear?
Clear, ma'am.
Yes. Then basic experimental design, that is your under true experimental. These are the types: pre-test, post-test, that is before after design, post-test only design, then Solomon four group design, factorial design, randomization, and crossover design. So these are the design. Then another thing is quasi-experimental. So what is quasi-experimental and pre-experimental? Quasi means here, like true experiment involves manipulation of an uh, or intervention, but this is lack of randomization. So what is the difference between experimental and non-experimental? In experimental, you have to give certain intervention. Okay, that is your manipulation. And in non-experimental, no intervention. Are you getting me? For example, we are giving hemolytic laddu to the anemic patients to improve the anemia, the hemoglobin level. So these are different therapy, and also there are certain research only to evaluate study, only knowledge assessment. So these are not, these are the qualitative study. These are not under experimental. Okay, that are some non-experimental. Experimental means certain intervention is there. So, in what is the difference between a pre-experimental and quasi-experimental? In pre-experimental, there is RCT, randomization, control, and manipulation. These three things are present. But in quasi-experimental, that is manipulation present, and treatment intervention. Experiment means intervention is there, but in quasi, that is intervention and control group is there, but here no randomization. This R is absent in quasi experimental. Then there are also different subcategory of this quasi experimental. You can go to that. Then after, what is the pre-experimental? Pre-experimental is a weak experimental group. Okay, this is the weakest type of experiment. So what happens in pre-experiment?
There is randomization,
Randomization
control,
present or absent? Here.
control,
Randomization
control.
is absent. Okay. Then R is absent. C is absent. Only intervention.
Manipulation, yeah, intervention.
There. Okay. So this is the difference between three, the experimental, that is true experimental, pre-experimental, and quasi-experimental. Okay. So many things. We might not have covered all these things only. Time is less. So shall we cover the research design one by one, or you have to know little about the sampling? What you want to know? 15 minutes only remain. Sampling, we have to discuss little about sampling.
Okay, ma'am.
Or research, or research design one by one. There are 2-3 classes will be taken in research design, not it will finish.
Ma'am, it's okay. We'll study by ourselves.
Yes, yes. So sampling, we should discuss little about sampling.
Yes, ma'am.
Is it visible?
Yes, ma'am.
So what is sampling?
A group of people on which we perform our experiment.
Sampling is the process of selecting a portion of population to represent the entire population. Okay. So what is sampling? It is the process of selecting portion of population to represent the entire population. For example, we are doing study on effectiveness of jamun seeds powder on diabetic clients in a selected community. Okay, so in Ganjam or Barampur, that selected community people is a sample. Okay, and the process through which you are selecting the sample, that is called as sampling. So what is population? A complete set of elements that possesses some common characteristics defined by the sampling criteria established by the researcher. Okay, that means population here, a complete set of elements that possesses some common criteria characteristic defined by the sampling criteria by the researcher. So you have to identify the diabetic clients. So all diabetic patients are your populations. That means those sugar level you have to identify in your research. That is, you have to take the patients who is having sugar level above 140, fasting sugar level above 120. That is your population. So a complete set of elements that possesses some common criteria or some common characteristic. That here your common characteristic are the diabetic patient. Those are having fasting blood sugar level above 120, defined by the sampling criteria by the researcher. That criteria vary from researcher to researcher. Some researcher, they want that I will take the diabetic client, those are having blood sugar level above 120, fasting blood sugar level. And another researcher, they fix a criteria, I will take the diabetic clients that those are having the fasting blood sugar level above 140. So according to research interest, they can fix this characteristic, the criteria. Then these population components, two groups, that is target population and accessible population. So the target population, for example, the universe and accessible population, the portion of the population to which researcher has reasonable access, may be subset of the, it is a subset of the target population. Okay. So what is the difference? What is target population and what is accessible population? The target population, for example, universe, for example, all diabetic clients are your, in the universe are your target population. But the portion accessible population, the diabetic clients, those are present in the urban area, particular urban area in the community of Berhampur, that is your accessible population. Okay. Clear?
Yes, ma'am.
Next. Example, all institutional elders with Alzheimer's and all institutional elderly Alzheimer's in MKCG, all people AIDS in the world, that is universal population, your target population, accessible population in that particular area where you are going to study, that is your accessible population. Example? Clear?
Yes, ma'am.
Okay, next. What is sample? The selected elements, people or subject chosen for participation in the study. Those elements may be people, may be objects. That is called as participant, subject, elements, or sample. The selected elements chosen for a participation in a study. People are referred to as subject or participant. The selected elements, those are chosen for the study, they are called as sample. And each element is called as, each element of the sample, suppose 30, there is 30 sample. That means the selected elements, that is people or subject, they consisting of 30. But each element is called as subject or participant. Sample lo each element is known as subject or participant. The sample hochi kona, a subset of population used to study the population. Sorry, what is elements? Elements कहली individual members of the population whose characteristics are measured, therefore constitute the sample. Sampling frame कौन? A list of all the elements. You have to make a list. That is sampling frame. Sampling plan. What is the relationship between sample and a population? A sample is simple subset of a population. You should not go through about details. So what is a good sample? Representative. That means the characteristic of sample should be matched with the population from which they are derived. The sample should be subset of population. So there must be similarity between the characteristic of the sample and population. It should be free from bias and error. Bias है कि you should not take the sample by biasing. That she is my close, so I will take that people for the my sample. That is bias and error. No substitution, incompleteness of the subject, appropriate sample size. So why it is essential for sampling? To draw conclusion, it should be complete enumeration, may not be possible, resource, lower cost, less demand and personal speed, faster results due to lesser coverage. So we cannot study in the whole world. Clear? So for a research, if I will do a study, the total diabetic patient in the universe, can I do my study?
No, ma'am.
No, ma'am.
To reach each and every person in the world, each and every diabetic person in the world for my thesis work. So I should take a portion of the population, that is sample. Complete enumeration may not be possible. It's the sample, though sampling is a lower cost, lesser demand and personal speed, faster result, because we cannot reach the universe, the reliable information to draw conclusion about a particular. So sampling is also essential to draw for study findings. If we take the whole world as a population for our study, in the statistical we'll calculate and never it will be finished. Okay, that's why to draw conclusion about the population, or for evaluation for effective result after statistical analysis, sampling is essential. Objective, same like disadvantage of sampling. That is a factor required for sampling, researcher nature, sampling nature, circumstances, inexperienced investigator. ଯଦି first new researcher ହେଇଥିବ, then it is very difficult to collect the sample. Lack of interest. Only the researcher, if don't have sufficient interest, then also that is that is a factor for collecting sample. Lack of honesty, intensive workload. If there is many workload, inadequate supervision, proper supervision failure ହେଲେ sampling ହେଇପାରିବନି. And now the sampling process. First, you have to identify the target whole population. After that, target population, then accessible population, then sampling unit, selection method, sample size, then you get the desirable sample. Let us know about different sampling technique. So different methods of sampling techniques are there. There is non-probability sampling, there is probability sampling. The non-probability sampling is again divided into. Sir, are you able to see the slides?
Yes, ma'am.
So non-probability sampling are divided into different types: convenience, judgmental, quota, and snowball. And probability sampling is simple random, systematic random, stratified, cluster, and other sampling. So probability and non-probability. Probability sampling is an every sample or elements has the equal chance to be the sample, and non-probability that is not. A probability sampling scheme is one in which every unit in the population has a chance to being selected in the sample, and this is probability can be accurately determined. The probability sampling, equal probability of selection is there in probability sampling, that is EPS, self-weighting sampling. So there are different features. So common probability sampling are there: simple, random, systematic, stratified, cluster, and others. Simple random, simple, equal and independent chance. Single, divide, you have to divide is some elements independently. So different methods like flipping a coin, steps, lottery method, table form, use table, computer, you have to computer. Randomly, after getting data, you will randomly take the sample. So randomly, like that, you have to draw the table. Then randomly, every element has the equal chance, not selecting. Then merit, demerit, every sample has there. Then systematic sampling. Every case, systematic sample by you have to sample the number 1 to n. Then there is a n sample size. Then there is a formula k equal to n by n. After that, you have to take the sample r equal to r plus k, r plus 2k, r plus n minus 1 into k. So is it understood?
Madam, kindly provide the PDF.
Part?
Kindly provide the PDF after the class.
Okay. So next, for example, systemic sample, how will collect number? Suppose 1 to 10, 1 to 50 population is the population size is 1 to 50, 150 population. Decide 1 to n, that means 150. Then calculate small n, that is n equal to a sample size. We require a sample size 50, that is our desire. Then select an interval, that is k equal to n by n, that is 3. then randomly select 1 to k. That means 3. From 1 to 3, k equal to 3. From 1 to k means 1 to 3. That means, and kth unit r plus k. That is 3 plus 6 plus 9, 12 and 15. This is your sampling size. Then systematic sampling. Systematic. Systematic over, then that is your stratified. You have to make different strata. Sampling, you have to make different strata or subgroup like that. Women and men draw a sample from each stratum, like every third, every one. Okay. Then cluster sampling. You have to make one cluster. After that, you have to select the sample. Similarly, non-random sampling is there. Non-probability sampling. So what is non-probability sampling? Any sampling method where some elements of population have no chance of selection. Okay. So these are the sampling, purposive sampling. Not equal chance of selection. Purposive, convenience, quota, snowball, consecutive, volume test. So purposive means, for example, researchers use personal judgment. It is otherwise called a judgmental authoritative expert's choice. The researcher's choice. That's why this sampling has less weightage because randomization is absent in non-probability sampling. The researcher's interest, the whom she wants, she can take. Then purposive. The researcher believes that some subjects are fulfill the research criteria, so accordingly she can take these samples. That is your purposive sampling or researcher's choice. Example, a researcher wants to study the life experience of post-disaster depression among the living after earthquake. After earthquake, she want to study on post-disaster depression among people. So she went. Those are the victims who victims of earthquake disaster and have suffered. Those have already experienced. The total people he took as a sample. So this is about purposive sampling. So next sampling is convenient. The attempts to obtain sample convenient. Response are selected because they happen to be the right place at the right time. Convenience sampling example, subjects are selected because they are easily accessible to the researcher. For example, this is the weakest sampling. For example, we can give. These are called as accidental or haphazard sampling. If a researcher wants to conduct a study on the older people residing in her area, the researcher observer and take all the older people coming to morning walk. It is convenient, easily accessible. Those are coming to morning walk, all those people the researcher want to take as a sample. So this is convenient sampling. Next, consecutive sampling. So consecutive sampling, continuously changing population such as hospital patients. So here, all subjects, the person want to take total sampling, enumerate sampling. For example, if a researcher wants to study activity pattern of post-kidney transplant patient, he can select all the post-kidney transplant patients who meet the designed criteria. So this is called as your consecutive sampling. Next, quota. Example. Sorry. Snowball sampling, what is that? This type of sampling taking works like a chain referral. This is known as chain referral sampling. Like, for example, researcher wants to conduct a study on HIV/AIDS among commercial sex worker or drug abuser. So here, one person can give one sample you have to take in. So she can give referral to other two patients. Then they can refer to other patients. So these are your snowball sampling. Okay. So these are some sampling techniques. We discussed about what is research, what is a nursing research, the meaning, the definition regarding what is research process, review literature, research design, and sampling. I think you may know little about what is research. Yes. Are you able to got some idea regarding research? Yes. Anjali. Are you able to hear me?
Yes, ma'am.
Okay. So I think you people have got an idea regarding what is research and so on.
Yes, ma'am.
So you can go through your topic. If any doubts or you need any clarification, then also you can clarify. There is a way for clarification also. You follow your book. That is your Black 6, paper 1. Okay.
Okay, ma'am. Ma'am, today is our last class. When will be our next class?
Actually, I think this is perhaps your last class. There may not be next class. So you can confirm from your coordinator.
Ma'am, that means Rajlakshmi, ma'am.
That's like you don't have any contact to your IGNO study center.
Yes, ma'am. We have a group and she's also included there. So
You can
we'll ask.
ask them. You can ask them.
Okay, ma'am. Okay, ma'am.
Okay, sure. Shall we leave now?
Ma'am, please take your contact number.
I have given my contact number. I have already given to you people in that last class. So
Ma'am,
Ma'am,
please give
what
in
about
again.
ma'am? What about our practical exam?
that's like ma'am have joined last class, na? You
Ma'am,
might.
but ma'am left so early, so we can't ask anything.
No, you can ask in the group because she is the authority and she can decide. So we will ask, then we will inform you directly. You can ask in the group and directly you can ask them. Everything you
Okay,
are
ma'am.
the what? You are not the teenage group people. You are the matured one. You can ask friendly. Why people you are? Why are you? What? Afraid
Okay,
of
ma'am.
asking these things? You can ask them there directly.
Okay, ma'am.
Ma'am,
Okay, ma'am. Thank
someone
you, ma'am.
also asked her, and maybe she's not present that time. Maybe after that she will see and she will give answer.
Okay, okay, okay. Okay,
Thank you, ma'am.
thank you so much. Thank you. So, Sally left now.
Yes, ma'am.
Okay.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you. Thank you so much.
Thank you, ma'am.
So So everybody can, if you collect, if you want anyone's contact number in the group, it is all members are in, all ma'ams also available in that group. You can collect from there. Okay.
Ma'am, oh,
What you asking?
no, ma'am, already added in the WhatsApp group, but nothing shared in the group.
Why?
No, about the assignments and the date of exams, nothing shared.
You people ask repeatedly. Ask your IGNO coordinator also. Okay.
Okay, ma'am. Okay, ma'am.
Okay. So may I leave now? Thank you so much.
Thank you, ma'am. Tomorrow onwards, no class, no?